So welcome everyone. If you are on a chair or a couch, just make sure you're not too wobbly, you're not going to fall off just while we do a quick warm up. And obviously if you have any injuries or anything like that, then you just do as much as you want, but all we're going to do really is move our arms. So feet nice and flat on the floor in front of you, and we're just going to start from the head and we're going to work our way down through the body, and just starting looking right to left, nice and gentle. And then whilst we're doing that, we can start to just lower our shoulders as well. So getting a nice range of movement, right to left, nice and smooth. And get that breathing all the way down into the diaphragm. So moving into our tummy area rather than using our shoulders. Lovely. And looking straight ahead, and now just looking up towards the ceiling, but just a nice gentle lift. Don't crunch the back of your neck. Just little gentle to look up towards the sky. And then come back through center. And then this is lovely on Zoom. Give yourself a double chin and then look down at the floor. So you can give a good old stretch to the back of the neck. And repeat that one more time. So just a gentle lift up towards the sky. Come back through, double chin, and look down towards the floor. Lovely. Come back up through center, and then just using your right arm first, we're just going to reach across diagonally, then reach across sideways, and then reach across diagonally down towards the floor. And just repeat that 3 times with the right arm. So going up, sideways, down. Just get a good old stretch through the shoulder blade and reach as far as is comfortable for you. And then swap. So we're going to do left arm up towards the top, across sideways, down towards the floor. And repeat that 3 more times. Sideways and down. And across, up, side, and down. Lovely. Straight away, get some shoulder movement. Get rid of that tension in the shoulders. Nice and mobile. Lovely. And then, I love doing this one, flip forwards, sideways, up, down. See how fast we can go. Forwards, side, up, down, forwards, up, side, down, forward, side, wherever you want to go. And then just finish with some wrist rotations. So hopefully we've got a little bit of blood going around the body, a little bit of blood up into the brain. And I am going to pass over to our CEO, who is Emma, and she's going to introduce our mental health and social isolation virtual coffee morning.
Thank you very much, Lizzie, and I feel all warmed up now. Thank you. So welcome everyone. I usually start off by saying Assalamu alaikum, Sat Sri Akal, Namaste and hello, which is traditional Asian greetings. And I want to welcome you all to our January coffee morning. As Lizzie said, we're talking today about mental health and social isolation. Feels like a little while since we've done a coffee morning. I know we've had several events in between, but actually a coffee morning, it's been a few months, and I miss being in the room with people physically there, but this is the next best alternative, and I'm so pleased so many people have come along today. So my name's Ima Mir and I'm the CEO of the Asian Resource Centre. I know we also have our chair here today who's joining us from Amsterdam, so this is becoming quite an international stage for us. So just but before we start the meeting, I just want to make you aware I need to do a little bit of housekeeping. This meeting is being recorded, as Lizzie said, and will be uploaded to our YouTube channel and to our website. Please turn off your video if you're uncomfortable with being recorded. Everyone is on mute. As you can appreciate, with the number of people, it's not possible for us to conduct a meeting when everybody's mic is on. You can post questions via the chat facility, which is open now, and you will have an opportunity to ask questions later later. Please do not post any links or images on the chat, because you will be removed. We have to ensure safety first. Just a reminder that we are active on social media. Please follow us at ARCC on Twitter, Facebook, Instagram, and YouTube. So I'll briefly take you through the agenda now. Mamoon, if you can pull up the agenda for us, please. Thank you very much. After my introduction, we will go to a poll and do a poll. As you know, people who've attended our coffee morning before, we do like to understand what the members are thinking and around particular topics. So we will do a poll, and then we will go into our panel discussion. So we will be hearing from Dr. Shetty. We will be hearing from Tanya Kirrage. We'll be hearing from Susan Underhill and Dr. June Brown. And then you'll get an opportunity to have a question and answer session. So it'll be our public and our health professional panel. And then we will go to our second poll. And so I want to, and then we do have a raffle and some birthday celebrations to do as well. So I'd like to straight away go to the first poll, please.
Hi, good morning, everybody. So the first poll, the question that we're asking you is, if you or someone you know had a mental health crisis, would you know who to contact in Croydon? You should see the poll up on the screen now. We've got 75% of people voted so far, 78% voted. I think we're almost there. So I'll read you the percentages at 1 minute, and that's now. So people who have said yes, they would know where to contact in Croydon if they had a mental health crisis, we have 45%. People who said no, we have 36%, and people who weren't sure, 18%. So 15 people yes at 45%, 12 people no at 36%, and 6 people not sure at 18%. Thank you for taking part.
Thanks very much, Richard. And of course, the poll is anonymous, so we won't know who voted for what, but we will share the results at the end as well, when the comparison between the two. Thank you for that, Richard. So we'll go into our session now. Mental health will affect 1 in 3 of us throughout our lifetime, yet it is still very much a taboo topic in certain communities. Some reports suggest that social isolation and loneliness are deadlier than heart disease, even worse than smoking 15 cigarettes a day. While the terms loneliness and isolation are sometimes used as if they were synonymous, they refer to 2 different concepts. So therefore, it's possible to be isolated without being lonely, and to be lonely without being isolated. We know that the COVID-19 pandemic, during that, social isolation, loneliness and mental health is increasing dramatically. And lots of organisations like ARCC, who've been working in this space for many, many years, we're worried that the progress that we've made so far is being reversed as lockdown and the pandemic continues, and we encourage people to socially isolate. So what we want to know is, are we taking these issues seriously enough? Are we talking about it enough? Well, why don't we talk to our specialists panel and discuss the topic? I want to introduce the panel at this stage. Apologies, I said earlier Vital Shetty, who is in fact Vaishali's husband, and it's Dr. Vaishali that's with us today, not Vital. So Dr. Vaishali Shetty and also her colleague Tanya Kirrage, who are here today. I'll introduce them first. So Dr. Shetty is a GP partner and a GP trainer at Birdhurst Medical Practice in South Croydon. She's also a member of the local medical committee. Dr. Shetty works for Croydon Place after the South West London CCG as a mental health clinical senior responsible person. Thus, her interest in promoting Croydon talking therapies. Dr. Shetty's first job after completing her MBBS in India was at Croydon University Hospital. And Dr. Shetty has a special interest in family planning, and she also provides a service in her practice. Dr. Shetty can speak 7 Indian languages, so it's easier for her to develop rapport with her patients in Croydon. Also, we have with us Tanya Kirrage. Tanya is a senior psychological wellbeing practitioner working within the Croydon Talking Therapy Service for 3 years, delivering low intensity CBT to support individuals with common mental health difficulties. So could I ask both of you to talk for 10 minutes about mental health, particularly in Croydon? We'd love to hear some helpful tips and exercises, as well as some of the information on mental health services that SLAM offer. Thank you.
Hi, morning, everyone, and Happy New Year to everyone. And thanks for changing my name back to my name. I do love my husband, but not that much that we'll swap our names. Thanks for that. And hope all of you are really well and keeping safe. So before I hand over to my colleague Tanya, who's from Talking Therapies and has got an amazing presentation today. I just wanted to sort of just read out a short passage from Bhagavad Gita. And I thought this was really thought-provoking, and especially in this time. And it starts with saying the lessons of moderation, very thought-provoking. So what it states is, for him who is moderate in food and diversion, whose actions are disciplined, who is moderate in sleep and waking, yoga destroys all sorrows. Don't do too much or too little of what is important in our daily life. With food, eat enough. With sleep, get enough. With speech, say enough. With exercise, exercise enough. With meditation, practice enough. And with work, perform enough. So I thought this was really relevant given our present time to have that balance, especially during this time. And as a GP, I would just like to emphasize that physical health and mental health are all interrelated, and they are really important together for us to have a good life. And as we know that, and I've always said this, that precaution is always better than cure. Thus, preventative and proactive healthcare has a very important role in managing our well-being. So I would just say, give it a thought, and I'll hand it over to Tanya now and probably take questions later on at the end. Thank you.
Thank you so much. Thank you, Dr. Vaishali. That was a lovely introduction. And thank you as well, Lizzie, at the beginning for that exercise. It's been a busy morning, so it was nice to just take a moment and slow down. That was lovely. Thank you very much. Hi, everyone. So I'm not sure if Lizzie's going to be able to put up the slides today for everyone to see. Amazing. Thank you so much. So as it's already been said, my name is Tanya Kirrage, and I work as a senior psychological wellbeing practitioner within the service. And I'm very grateful to be invited along today to talk to you guys a little bit about looking after emotional wellbeing. My understanding is I have about 10 minutes, so may kind of whiz through a little bit, but don't worry, I've sent the slides over to Lizzie and she can definitely give you those for your own kind of reference afterwards. Excellent. Can I control the slides, Lizzie? Oh, excellent. Thank you. Okay, so Croydon Talking Therapies. So we are an NHS service that provides psychological therapies for anyone within the Croydon borough. So anyone with a Croydon GP who is aged over 17 and presenting with common mental health problems. And we'll talk a little bit more about what we class as common mental health problems. And to be eligible, you need to live in Croydon and be registered with a Croydon GP. The telephone number for our service is there and the website just at the bottom of the slide. And later on, I'll talk about how we refer to the service. The main thing to know with our service is that we are here to support anyone at all with common mental health problems over that age. And we're not just GP referral, we are also self-referral. So what that means is if you are experiencing difficulties, you're not sure what's going on, and actually you think you might be struggling with a bit of low mood or anxiety, you can then go to your GP and they can refer you to us, or you can skip that altogether and come to us directly yourself. So there is 2 ways to access our service, and we are free. We're an NHS service, we're free, okay? So the next slide, thank you. So just to kick off, and I know that we're all using the chat here, but just to open this to the floor a little bit, what do we think all of these people have in common? And just post your answers in the chat. Yep, celebrities. Yeah, they're all rich celebrities. You're right, Lizzie. Yes, Jay Patel said emotional issues. Yep, experienced mental health issues, suffered anxiety and depression. You're absolutely right. Absolutely. So all of these people have experienced some sort of mental health difficulty. So we know David Beckham suffers with OCD. We've got a lot of people here experience depression. So Adele, depression. We've got Stephen Fry, borderline personality disorder. So there's a lot of different mental health issues within this group. And actually, you know, someone said at the very beginning, 1 in 3 people will experience a common mental health difficulty. And that's the people who report it. So actually, it's probably a lot more widespread than what we think it is. And it's really important that we have these discussions to start normalizing talking about mental health and getting support for mental health. Because to have whole health, we need mental health and physical health, and they're very much interlinked. We see the two will impact each other. So it's really important that we recognize that actually it's very common and very normal to experience difficulties like this, and to think about coming in, as Dr. Vaishali said, at the point of prevention rather than intervention, so that we can start to think about how we can manage that. So how do mental health problems develop then? So what we want to imagine is that everyone has what we call a stress bucket. Each of us have our own bucket, and everyone's bucket is a different size. And we will all have different taps. If you imagine a bucket and taps above it, and each tap will be pouring in to that bucket. And the taps will represent different types of stress. We might have environmental stress. We might have interpersonal stress. We might have academic stress. We might have intrapersonal stress. Lots of different things can pour into that bucket. And I would encourage everyone to think about this in terms of what their own bucket would look like. If you've got a pen and paper right now, please feel free to draw a bucket out, draw some taps at the top. Think about what your taps would look like. You know, what would each of your taps represent? And each line in that bucket there, the example we're looking at, represents a different type of stressor. Nature, you know, what goes on around you in your environment, your early life experiences, major life stresses, COVID, you know, these are things that are going on at the moment, critical incidents that might occur. And this bucket fills in life. And what happens is sometimes our bucket can overflow. And what we want to do within therapy is we want to help to create taps at the bottom. You'll see there it says protective factors. We want to develop coping strategies, nurturing activities, self-soothing support systems that we can put in place to help to release the pressure in the bucket. Because we might not be able to control the taps at the top. You know, sometimes the situations we're in might not be in our control, but that doesn't mean that we can't do something within our own behavior, our own thoughts, to help us to cope better with it, to be able to manage it, put things in place. And that's what we want to develop. We want to develop the taps at the bottom to release that pressure from the bucket. So let's think a little bit about stress and depression, first of all. So stress is a word that a lot of us use, isn't it? You know, I'm feeling so stressed out, I'm very stressed. And actually, what is stress? Stress is how we describe demands upon us. It's when we feel the demands upon us outweigh our ability to cope with them. And stress will vary from person to person. Some people's reaction to stress might be to procrastinate. You know, it might be to avoid, it might be to put things off. If I don't face it, then I can just pretend it's not there, which leads to more stress. And actually, it's this general feeling of being very overwhelmed by all the different things that are going on. Depression, that's when we might feel low or hopeless. People, when we feel depressed, people might describe this feeling of feeling like there's a black cloud following them around, struggling to enjoy things. Something within our service actually that we're seeing a lot more now, we're seeing an increase in, because actually COVID has meant that a lot of people aren't able to do the things that help relieve depression for them, seeing friends, seeing family, being active. So they might find that actually they're starting to feel this sense of a black cloud. Other symptoms might include being quite tired, not feeling motivated, feeling quite deactivated. The things that came quite easily might feel quite difficult to do. You know, I used to do this all the time. Now I'm really struggling to pull myself up and do it. And self-care can slide. You know, it might be difficult to get out of bed. It can become very difficult to engage with your day-to-day activities the way you used to, or the way that you want to do. Anxiety. Now, anxiety actually encapsulates quite a lot of different things. Generalized anxiety is probably the most common form of anxiety that we see within the service, and this is what we call worrying excessively. Often clients will talk about this what if worry. Worries about the future, worries about things that you may or may not be able to do, you may or may not happen, that you can do nothing about. So what if this happens? What if that happens? What if this happens as a result of that? And then we spiral and get to these worst case scenarios. So it's worrying about things that may or may not happen, that are out of our control. And it's that intolerance of that uncertainty can cause us to feel very kind of overwhelmed again. So it links, sometimes we can see there's a little bit of overlap between stress and anxiety, but actually anxiety more is based around worrying. Specific phobias. People present with us in our service with phobias of specific things. Social phobia, we call that social anxiety. So feeling very anxious about social situations. Before it, during it, and after. So before, you know, what if I say something stupid? What if people think X, Y, Z about me? During, thinking, oh, that person's looking at me in a certain way. Are they thinking that I look silly? They're thinking I'm not making a lot of sense. They're thinking that I'm not clever or intelligent. And then afterwards thinking, how did I come across? What was the way I conducted myself? How was it perceived? Health anxiety. So that's when we worry excessively about getting sick. Again, something that we're seeing an increase in because of COVID, and people worrying, actually, there's something wrong. Maybe they might be doing a lot of checking behaviors, reassurance seeking from doctors, presenting more to the health professionals. And then OCD. And actually OCD is probably one of the most misunderstood conditions, because when we say OCD, people think of excessive cleaning or fears of contamination. That is OCD, but actually there will be a thought that causes that to happen. So someone might wash their hands maybe 10 times a day, but that's not just because they have to wash their hands 10 times a day. There's a thought, if I don't do this, so-and-so might get sick. And then if they pass away, that is my fault. So there'll be a cognition that pushes that person to do that. So we want to think about, well, what do we do about these things then? These are very common, very normal. 1 in 3 people are experiencing these types of difficulties. So what do we do about it? And we use something called cognitive behavioral therapy. Cognitive behavioral therapy is a proactive, empowering, hands-on, skills-based technique and tool that we teach people. And it's all about this link between our thoughts, behaviors, and emotions. What we think affects how we act and feel. What we do affects how we think and feel. And what we feel affects how we think and do. They are all interlinked and all affect and impact one another. And what we do in CBT is we're coming at the point of behavior to teach you tools and techniques and strategies to help you to develop ways to cope and change your behavior so that you're thinking in a more helpful way and you're feeling better. And so briefly, what kind of changes can we make then in CBT to change those cycles of depression, stress, anxiety disorders? When we're looking at LOMID, we talk about this balance of routine, pleasurable, and necessary activities. Really starting to think about helping you to, in anxiety, manage your worries better so they don't feel unmanageable. So we teach you worry management techniques. We look at helping you to improve your sleep. We look at something called sleep hygiene so that you feel more able to cope with your stresses on a day-to-day. Because what happens is all these things add up, they start to impact sleep, which then impacts our ability to cope with them even more, becomes a cycle. So we look at that as well. We make lifestyle changes that improve energy levels, things like helping you to put in some helpful coping mechanisms. Exercise is so important to help you boost your mood and help improve that sleep as well. And we also do thought work, something that we call cognitive restructuring, which is all about helping you to challenge your negative and unhelpful thinking styles. So some things that everyone can have a look at here, just some self-help resources that we give out. These are available online for you to have a look at if you want to understand a little bit more about CBT, explore it a little bit more before perhaps you contact the service. Obviously, pre-COVID, I'd also mentioned that you can get all of these things in hard copies at the library, but obviously I don't think that we're allowed to do that at the moment. So really kind of these are the links to go into if you want to understand a little bit more. So what do we offer at the service? Briefly, I'll just go over this. So we offer an online intervention, which is a 6-week program where you work through modules each week that help you develop tools and techniques to manage. And this is something that's proved to be very popular before, because it helps when clients can't kind of travel to appointments, when they can't keep a certain time. So this is something we're noticing is quite helpful for clients who struggle to maybe see us in working hours, who might struggle to commit to the same time every single week and actually want to work through at their own pace in their own way. So online can be really, really helpful for that. We also offer 6-week groups, which we are running now through exactly how we're doing this now on an online intervention. And that's around, one group is around stress and worry, the other one's around behavioural activation. Stress and worry works on helping you to manage stress and anxiety, and behavioural activation is all around helping you to manage depression, low mood. And then LTC management. Now we are really aware, obviously, the link between mental health and physical health. And there is a lot of clients get referred to us with long-term health conditions. So that's where it can be really helpful to actually engage with mental health support when you are experiencing a long-term health condition, because we can notice that the long-term health conditions impacts on mental health and mental health impacts on the condition. Real links there. So we offer support around that. I also run myself a 10-week group called the Low Self-Esteem Group, which is for clients who might struggle with self-esteem difficulties, and that runs on Monday evenings. We have guided self-help, which is telephone or video, depending on the client's preference, and that's 6 weeks of therapy at 30 minutes each. Counselling is the only thing here that isn't CBT based. Counselling is more so an intervention that is offered if you feel that you want to talk about things, to talk about the difficult experiences you've experienced in your life, to really start to unpack and explore and process. Imagine it like when you get all the clothes out the tumble dryer and it's all one tangled big mess, and you take each item one by one, you fold it, and you end up with this nice tidy pile. That's what counselling helps you to do with your life experiences. Very different to CBT, which is more about saying, how do I move forward? What are the tools and techniques that are going to help me cope? Employment advice works with helping get people into work, but also works on helping people to get into voluntary opportunities as well. And they sit within our service. And finally, cognitive behaviour therapy. So cognitive behaviour therapy is 12 weeks of sessions, and it's 1 hour a session. And this is perhaps for clients who might present with difficulties that have been more long-standing, a little bit more difficult to shift. We'll offer that little bit more intensive, high-intensity support. So how to access the service? You can self-refer via the website that's there, okay? Or you can call the number there, okay? So that's the 2 ways to refer to us, or you can go to the GP. Completely up to you. But what would happen is when you refer to the service, we will offer you a telephone assessment, which is 30 minutes long, where we assess your difficulties and we work out how we can support you, what the best service might be to meet your needs. So you don't need to know what's going on or what you need, or to be completely sure that you need the service before you call us. You can call us and we will support you in figuring that out. Okay. And one of the things that we like to talk about, of course, is risk as well. So sometimes what we might find is that when people are experiencing mental health difficulties, and especially if they're experiencing low mood, they might start to experience some thoughts of perhaps feeling quite hopeless, or quite kind of feeling, oh, do you know what, I'm feeling a little bit like, what's the point? Or I don't really want to be here right now. And actually those thoughts can be quite difficult. So if you are concerned, if you are feeling at risk of harm to yourself, then the first point of call we'd say is, if you're starting to have thoughts and you're not in therapy, we'd say contact your GP. You can talk about those thoughts with them, and they will then offer you that support and refer you to us. If the GP practice is closed, you can contact your out of hours GP service as well. If you feel, actually, I'm having those thoughts and I'm quite concerned for my safety, You can present at A&E. A&E do have a mental health service within them that sit there and wait for those referrals. So that is absolutely fine. You're not going to go in there and someone's going to say, there's nothing wrong with you, go home. Not at all. It's very much that they will talk to you, they will assess your needs and then go from there. Same with calling an ambulance. If you were concerned for your safety, you can do that as well. It's just as much there for mental health as much as it is for physical health. And then also you can always get some support from services like the Samaritans, 24/7 anonymous, confidential, free to use support line. Can email them, can text them. The people are trained to support, and other services there. So do please keep those in mind. Okay, I'm aware I've just sped through that. I do apologize. I'm not sure if I've gone over either, Lizzie. So I do apologize about that. Oh, good. I stuck to the timings. There's lots coming through on the chat and I haven't been following it as I've been talking through, but I wonder, is there any questions here?
So what we're going to do is we're going to do Q&A at the end, but just so everyone's aware, Tanya is an extremely busy person, as I'm sure you can imagine. So she is leaving us a little earlier. So if you have specific questions for Tanya or for Dr. Vaishali, then please, do ask them now. So you can obviously post into the chat or raise your hand, or you can use the raise your hand function on the Zoom. But just to ask Tanya, I do know that one of the questions we had already was from Nazma, and they wanted to know, how can we help a family member who refuses to get help from these services, which I thought was a really important question.
Absolutely. And also always asked. A lot of people, can see people around them and they think, oh God, there's so many people who would benefit from this service, and how do I get them to engage? The really difficult thing here is that we can't make anyone do anything that they don't want to do. And so the best way to get someone to engage in services like this is to open up a dialogue about them. I would do things like leaving materials around, if you can, maybe kind of, talk about the service. You might say, oh, do you know what? I attended a talk today. It was quite interesting. They talked a little bit about this. Do you know what I mean? So just talking a little bit about what you've heard today, what it sounded like. And also sometimes people might feel that actually accessing therapy services is almost a bad thing, in the sense of, oh, I'm admitting defeat. But actually the element of CBT is that it's so empowering, because we're teaching you the way to become your own therapist. It's about teaching you tools and techniques and strategies and practical things. So actually it's a very empowering therapy. So exactly how you might for physical health, if you went to your GP and they said you need to lose a little bit of weight, we're worried about your health, whatever, they would ask you to start exercising. Exactly the same with mental health. We ask you to learn tools and techniques to help you to manage. So I would open up the dialogue in less of a you need to get help way, and in more of a, I've attended this talk and actually it sounds really good. They teach you ways to manage if you feel low, and actually I'm thinking about doing this. What do you think about it? That kind of way of talking about it in a very kind of open, non-judgmental. Maybe avoid words like depression or mental health problems. Sometimes people can find that a little bit harsh. Maybe more like, if you're feeling a little bit sad, you're feeling a little bit low, if you're not feeling yourself, those kinds of words can really help to open this up in a way that doesn't sound so judgmental, so to speak.
Brilliant. I just wanted to pass to Kumiko, who asked a question in the chat, and I just wanted to see if they wanted to ask you before you leave.
Yeah, absolutely. I think I can see the question. It's how long the waiting time in general to be assessed. Yeah, good question. So in terms of offering the telephone assessment, we offer you that within the week. So we always offer a telephone assessment within the week, and different interventions have different waiting times. In terms of the 6 sessions of one-to-one therapy, we don't have a waiting time for that at the moment. In terms of the sessions that are 12 weeks long, because they are 12 weeks long, there's a month wait for those, because obviously it's slower to turn people around. But everything else does not have a waiting list. So, and generally we will begin people with everything else. We won't put anyone straight into the higher intensity support unless they've had some sort of support before.
Brilliant. And Dilly, I can see that you've got a question, so I've just asked to unmute you if you go ahead.
Thank you. Thank you for that. I just want to check how confidential is this service to the people of Croydon?
Yeah, absolutely. Good question. Thank you for asking that. So confidentiality is above all the most important thing within this service. Everything is confidential between you and the service. We share information with GP, but if clients ask us not to share information with GP, we also don't do that either. So it's that level of confidentiality. It is completely up to you. The only exception is if you are at risk to yourself or at risk to others. If we have any concerns around risk, then we will have to obviously involve other services. But if there is no risk, then absolutely 100% confidential. No one needs to know. It's not talked about. It's actually confidential within our lives as well. You know, when I come home and when I used to go into the office and my husband says, "How was your day?" Fine. That's all he needs to know. There's no talking about patients. There's no disclosing information. Confidentiality is incredibly important to us, because if we lose confidentiality, if we're not confidential, people will stop coming. So confidentiality is very important.
Thank you. Thank you for that.
I'm just going to pass to Jay, who's got his hand up as well.
Yeah. Can everybody hear me?
Yes.
Okay. Tanya, thank you very much. That's very informative. I've learned a lot today. I just wanted to say something, but I see a chat message come through that from Dr. Vaishali Shetty saying that if you're worried about a family member, it helps by booking a joint appointment. I have been involved, or my wife's been involved in having a second surgery on her foot, which we waited for about 14 months. And it's depressing for me at times to see her walking with sticks, if you like, on crutches, because she's fairly active. She's played tennis for about 20 years and she lives a very active life. But for the last 12 to 18 months, it's been very difficult for her. And that has some side effects on me as well.
Of course.
And I get worried about her at times. So I just wanted to know if there was something that we can do jointly, rather than have these negative thoughts about, the appointment's not coming through, coming through.
Yeah. Jay, first and foremost, thank you so much. You know, your honesty and the way you've just kind of put what you're struggling with out there, I think is commendable. So well done. And thank you so much for doing that, because you're showing that you can be vulnerable and how okay that is. So well done. And actually what you're dealing with there is incredibly difficult, because you're dealing with a loved one whose situation has changed and you're having to see them in a different way, and a way that perhaps is quite upsetting for you, because it makes you think perhaps of the things that she used to be able to do that she can't now. So what I would suggest, Jay, is definitely do refer yourself to the service. And we do say that actually we can talk to you and your partner together in the first appointment and think about what the best options might be. So do refer yourself to the service, and then we can take it from there and talk to you on an individual level about that. Does that feel okay?
Yeah.
Thank you so much, Jay. Thank you.
Thank you. All right, so thank you so much, Tanya. I know that you do have to rock on, but I can kind of just get the vibe from everyone, getting the messages through, that what you have shared with us has been so helpful and really, really clear. And just, although I have said it in the chat, just for everyone to know, if you just send me your email address, I will forward you Tanya's fantastic PowerPoint, which has all those links in it. So please do just drop your email if you want that. But I think I speak for everyone when I say thank you so much, Tanya. And then just let you know that Dr. Vaishali will stay with us in case we have more questions at the end. But I'll pass back to Emma now, and thank you again, Tanya. Thank you.
Thank you so much. Thank you, everyone. Thank you.
Thank you, Tanya. Can I extend my thanks as well, and to those who ask questions, and Jay, if we can make the link between yourself and Tanya, I think that would be a good thing. And thank you for asking your questions. So Tanya, you covered a lot. You talked about the mental health bucket, you spoke about anxiety, CBT, self-help, and all the brilliant services that SLAM doing. Mental health, it really is a very taboo subject within the Asian community, and it's important that we talk more and we talk to yourselves and other services. So I think today is a starting point for us to continue these conversations with yourselves, and again, thank you very much from us. And I know you have to leave now, so I look forward to Vaishali fielding some of those questions, more questions that come along. So we've got over 60 people in the room, which is great because we're hoping we can reach out to as many people as we can. I'd like to introduce my second panelist, who is Susan Underhill, and she's the Programmes Director at Age UK. Susan's got very good knowledge of working with marginalised communities and vulnerable groups, and I've personally used a lot of Age UK material when it comes to social isolation and vulnerable people. So I know they do some incredibly good policy work and some good resources out there for even practitioners. So Susan works with marginalised and vulnerable groups, including people with learning disabilities, mental health problems, and people who are digitally excluded, and older people. So Susan develops services and solutions to meet government strategic aims, as well as individual and organisational goals. She has an independent, impartial approach to delivering business solutions to support small organisations in the third sector. And Susan specialises in business planning, operational planning and implementation, business strategy, training and develop, impact and evaluation process. So you do lots and lots of things. I can see. Please could you talk to us about social isolation in Croydon and some of the brilliant projects that Age UK can offer. Thank you.
Thank you very much, Emma, for that introduction, and thank you for giving me an opportunity to join this brilliant coffee morning and be part of this whole process. In addition to all the things that you've just listed out, actually my passion is about making things better for people who are struggling with a number of challenges and health inequalities, but mostly it's around person-centered. It's not about what I think or what anybody else thinks. It's actually what does the individual, what does the person want and need. So Age UK Croydon is very much around person-centered approaches, and people who work with me know I'm always asking questions. So what does the older person think about that? What's their view? How would that look for them? So that we always make sure that we get some great ideas, we're passionate, committed, but we're not the experts, older people are. And I'd like to say a huge thank you to Tanya for that great presentation, and it was great to hear that explanation of the whole service. And have to say that at Age UK Croydon, our Personal Independence Coordinator service are working closely with the IAPT service as an additional way of supporting older people. What I want to talk to you about is what is social isolation. And Nima, obviously you explained this at the beginning. It's so important to make that distinction between social isolation and loneliness, because people do think one leads to the other, and they are interrelated, but they are separate. And I wanted to sort of talk about what the social isolation is about, what impact that has, what impact it has on mental health, and what Age UK Croydon are doing to help combat that, which we're not doing alone. We have to work in partnership with our voluntary sector colleagues, not that we have to, we don't want to, and also with older people themselves, because it's a really complex issue. And finally, I would like to tell you about how we can get your help and support to enable us to continue to improve and to continue to tackle this huge problem. So social isolation is, in fact, as Emma already mentioned, it's the absence or weakness of a support network, which can lead to people being socially isolated. And the number of social contacts a person has, if they're reduced, can lead to deteriorating physical and mental health and internal loneliness. So it's the number of contacts and the value of those contacts that's really important for people. Not surprisingly, older people living alone who are already lonely and are unwell with long-term health conditions, perhaps living in poor housing or difficult environments, on low income, are even more impacted now because of COVID-19 and the further restrictions of lockdown and not being able to engage socially. There have been enormous challenges for older people who provide unpaid care for someone, often their partner, and for those who have been bereaved and prevented from grieving in the usual way. So the negative impact is well documented, and Nima again all referred to this. And Age UK Croydon is a local charity, an independent charity, but we are a brand partner with Age UK National. And people will have heard the campaigns from Age UK around the the impact of social isolation and loneliness can be as bad for you as smoking 15 cigarettes a day. It also leads to anxiety, depression, low self-esteem, loss of confidence, and that just makes it even harder for people to maintain or establish contacts that they need to address the social isolation. The other contributory factors are bereavement and loss of a partner or friends, so your social circle's reduced. And if you're losing your confidence and you've got low self-esteem, trying to build that network back up again feels like an impossible task. You've got family that are distant, moved away, can't come near you, you can't go near them, there's COVID-19. So already with the distant family, we now have the addition of people not being able to see each other. Or some people don't have family at all. Again, it's around aging and loss. Perhaps they've got poor health and mobility, which has made it difficult for them to get out. And again, through lockdown, with reduced access to exercise or a garden, that can increase the reduced mobility and increase the deterioration of their physical and mental health. The fact that you can't just go to the local shop or the supermarket, meet up with a friend, chat with a neighbour over the garden wall or the fence, keep up with your social groups or clubs that you were doing before, and indeed perhaps have had bereavement or loss on top of all of that, when it's been so difficult, just makes people even more isolated and has that negative repetitive cycle. And indeed, on top of all of that, we also have digital exclusion, which has been an issue for older people for a long time. And as Emma referred to earlier, Age UK, national and local Age UKs have been fighting to tackle what isolates older people, what excludes them from joining in, where more applications and forms such as blue badge benefits and so on and so forth need to be dealt with online. Shopping, when we saw this when COVID first hit, people did not have online shopping potentially and didn't have access to the basics of food. So the digital inclusion is really important. So how are we tackling this? Well, we have a different approaches to how we work with older people, and I go back to the person-centered approach. So our personal independence coordinator service will take referrals from the GP, working in partnership with them and the community to work with older people on a one-to-one basis. And that starts off with a guided conversation to understand the person, what's important to them, what do they miss, what do they need, what would they like to do, what's stopping them. And the guided conversation will then lead to the plan. So that's where we will often draw on our colleagues in the borough for different kinds of activities or groups. We have, as I said, referred to IAPT to help to address some of those challenges around mental health issues, again, the anxiety, the depression, low self-esteem. And we've worked with IAPT to develop our approach to this for the very reason that Jay was talking about and other people have mentioned. How do you have that conversation? It's really difficult, especially for some of the age group who are very much from a background of stiff upper lip and get on with it and not wanting to seek and ask for help. So it has to be a very careful and respectful conversation. So IAPT have worked with us to help us to improve our approaches to that. Like many of our voluntary sector colleagues and partners, we've had to move much of our work to an online platform. We can't do our exercise classes out in the community anymore. We can't have social groups coming together. We couldn't have the memory tree, which is one of our services, which is specifically aimed at people living with a diagnosis of dementia and their carers. And that's an increasing mental health issue that we, as an organisation, feel very passionate about supporting. People with dementia and their carers are frequently more isolated because their fear of going out, changes to their cognitive behaviour, all kinds of barriers start to crop up, and the changes that continue with that. And sometimes they just feel so cut off and isolated. So our Memory Tree Cafe has been really important. But we had to stop that. So that was running every Wednesday and twice a week on a Saturday. We've got it back up online now. We are running this on Zoom. So we're really proud that we've been able to find a new way of doing that. But we've also maintained telephone contact with people because some people aren't able to get online. We have worked in partnership with a local organisation to develop a training programme for our staff and our incredible volunteers to help them to learn how to help older people to get online. And we have some technical befrienders from the corporate world who are helping us as well. So we can always help somebody to get online and spend time with them, helping them to access social activities or shopping and different groups and contacts with their friends. We will continue to work on that digital program, because as we come forward, you know, we're all hoping the vaccine is going to help us to reduce that social isolation and help us to move back out into the community. But there's a big piece of work to be done to build people's confidence and to reduce the anxiety they have of being in contact again. So staying online will enable us to maintain that contact and have a staged approach to getting people back in contact with each other. Over Christmas, we organised an events programme from the 21st of December to the 4th of January. And we had a number of events going on: book club, quizzes, audio plays, knit and natter, a number of different activities which we had found incredible volunteers to lead. This was based on what older people told us they wanted to do or what would make a difference. So for the whole of that 15-day period, we had at least 2, if not more, activities going on every day, including Christmas Day and Boxing Day. We reached 100 people, over 100 people over that period, and we are now looking to add more of that to our weekly programme. Currently, we deliver 5 exercise groups a week, which is chair-based and standing exercise, supported by health talks and social interaction. So our healthier lifestyle services around addressing physical and mental health and social interaction. So we will provide exercise, we will help people to think about different conditions that they're living with. We'll be focusing on different conditions such as respiratory or Parkinson's, stroke recovery. So we'll be helping those people in different situations to engage in an exercise program online. But we will now have a new program which will launch by the end of January, which will also interact with some of these activities that we've talked about already. And we will continue to develop that based on what older people are telling us they want. We were doing our exercise programs, but we went back online, and we brought along a Tai Chi instructor, and we had a number of emails of people saying, can we have more of this, please, because we really like it. So we invested in bringing that Tai Chi instructor in on a weekly basis because that's what people said they wanted. We also have people from our Memory Tree Cafe joining our healthy exercise program as well, which is really brilliant. So we're very, very proud of that. In December, we launched our Friends of Age UK newsletter, which is available on our website and currently has a 400 circulation. But it's our way of sharing our news and activities and what's going on. So we will be using that to communicate with people and let them know what we're doing. We have our personal independent coordinator service. People can refer from the community, and if you know of somebody who's got 2 long-term conditions, perhaps had a couple of falls, who you feel would really benefit from one-to-one support, then you can refer them into our PIC service, and then we will, as long as they agree that that's what they want to do and they have the ability to engage in the service, then we can embark on a 12-week program working with them to identify their goals and helping them to get back to more independence and to improve their health and well-being.
Susan, thank you. Sorry to disturb your flow. We want to move the conversation because I know lots of people want to ask you questions. So I just want to get through the introduction so we can quickly get people to ask you lots of questions, and I think maybe we can pick up. Thank you so much. I'll give you a few more seconds to wrap up your presentation. Thank you.
Just finally, I just wanted to mention our information advice helpline. So if you want to get through to any of our services, you want to know about it, you can either go onto our website or you can phone our information advice helpline. I have sent Lizzie posters for the different activities. I will send her all the information for what I'm doing today, so that you will know how to contact us, and my own personal contact details, so that if you want to contact me for information or to be involved in volunteering or tell us what you think we should be doing, I really want to hear that. So thank you very much for the opportunity.
Thank you so much, Susan. And of course, you and I sit on lots of groups together, and interaction. So and thank you so much for talking to us about lots of things. You spoke about your PIC service, you defined social isolation and loneliness for us so we can understand it better. You spoke about the different effects that social isolation, loneliness, mental health, all the effects they have on people, and the cycle of negative impact. And you also spoke about digital inclusion, and it was great to hear about your person-centered approach and the interventions the excellent interventions that Age UK used to support some of the most very vulnerable people that we have within our borough. So we thank you for the work you're doing, and thank you for coming along today. And I'm personally looking forward to answering lots of questions from our members. I'd like to move on to our next panelist, who is Dr. June Brown. I had the very fortunate opportunity to speak to Dr. June Brown recently about the Friendship Bench, so I'm super excited about your presentation today. So Dr. June Brown is joined the Institute of Psychology and neuroscience at the King's College London in 1995. Having worked in the NHS for several years as a clinician and a psychology manager, Dr. June completed her Bachelor of Science at London University, Master of Psychology at Liverpool University, and her PhD at Birmingham University. Dr. June's primary research interests are helping to seek for mental health problems, psychological care for difficult groups to engage, informal care such as family, friends and religious leaders, early intervention for mental health problems, for example, 16 to 18-year-olds, university students and pregnant mums. Dr. June teaches on topics of depression, insomnia and self-esteem. Dr. June is a member of the current NICE guidelines for depression, the Depression Committee. She's also a review editor for mood and anxiety disorders of the frontiers in psychiatry. So lots of things, and a very skillful lady indeed. Dr. June, would you please explain to us a little bit more about your Friendship Bench project based on mental health? Thank you.
Right. Okay, thank you. Thank you very much, Uma, for that very kind introduction. I wasn't really wanting to focus so much on my academic background in this talk, because the thing that I wanted to do was talk much more about how it can be very difficult to seek help. So I am myself Chinese, although I've lived in this country for a long time, and seeking help for mental health problems is, I think, a very difficult issue. Taryn in her first talk, which I thought was absolutely excellent, Tanya in her first talk was absolutely excellent in terms of just saying, these are all the services that are out there, and also that there are a lot of people with mental health problems. So she gave the figure of something like 1 in 3 may have mental health problems. But the figure that she didn't give was that a lot of people don't actually seek help. And it is actually very difficult to seek help because in the past, it used to mean that you had to go to your GP, or you might need to kind of gather up your courage in order to get yourself seen by a specialist. And so I think, as part of an Asian community, I think it's important to just recognize that it's important to know what services are out there. So that's a really important bit of the overall picture with mental health and improving mental health. But the other bit of the picture to do with mental health is to also understand how it can also be very difficult to seek help. So in terms of my background, so what I've been doing has been to actually look at the papers to do with what South Asian people do when they have mental health problems. We hear a lot about Black people who have mental health problems. So these are Black when they're sort of Caribbeans or Africans. We hear a lot less about Asians. Asians are probably a much lower profile group, but the important statistics, you may not want to have more statistics given all the COVID statistics, but the important statistics are that South Asians have got a higher prevalence rate of depression and anxiety. So the rate of depression and anxiety is higher compared to Black people and white people. But the rate of seeking help is much lower amongst South Asian people. So we've got a high rate of problems, but a lower rate of seeking help. Okay, so that's really quite important. So we might say, okay, the services are out there, but it's also important to just have in your head that Asian people are reluctant to seek help. What are the reasons? And if we look at the literature, a number of barriers are flagged up. One is language. People will say, well, if I do go along there, I can't always express how I feel. And so, you know, sometimes it's important to recognize that while we can get by in English for practical things, sometimes it's difficult to express your emotions in English. Okay, so it's not like just because you know English that it'll make it easy. The second is not knowing what services are around. And Tanya has been very good in actually saying that the talking therapies in Croydon are available and you can actually self-refer. So that's excellent news. But even so, people don't always know what is available. The third point is not feeling that services understand them. So it's something around, you know, even if people do go, that people may feel, well, the services may not actually understand what I actually think is important. So I may think that it's really important what the family thinks, but the person in the service may not share that view. So there is a bit of a difficulty because then they feel that they need to explain why it's important. And that adds to the original problem, making it even more difficult to actually tell your story about the difficulties that you are actually experiencing. And the next and final one on the list that I've got is to do with stigma from the family. One of the things I feel as a Chinese person is that face was very important when I was growing up. A lot of the messages that I got about mental health were to do with do not do anything that will affect your face, that will mean that your face actually gets worse. So it's a kind of psychological face, but it's something about just, and it's similar, I think, with South Asians, which is about do not embarrass your family. Whatever you do, do not embarrass your family or say things that you shouldn't be saying, or do things that you shouldn't be saying that will bring.
No, I think that was just someone having trouble with their internet. Don't worry, Dr. June. Thank you.
All right. Okay, fine. Okay, so what I was wanting, in a sense, from this session was to talk to you about what you see as the common barriers to seeking help. So, as I said, Tanya has been very helpful in talking about services that are available. So I would actually appreciate it if you could put in chat what you see might be some of the barriers that might stop you from seeking help if there was a mental health problem, either for yourself or in your family. Because, as I say, it can be difficult. On the other hand, it might be that, you know, the barriers may be overstated, but I would appreciate your comments on that one. So I've set out the problem. And so what I'm going to move on to is talk about an idea about what we think might help. So this is not yet real, but what we're doing at the moment is we're searching for funding for this particular project. So the project that we've got in mind is called the Friendship Bench. And we deliberately have focused on the fact that it has got a nice title. It's a model that comes from Zimbabwe. And the thing that was so interesting was that it was offered by local women to other women and offered in their own language. So what was important was that it was offered in a much more equal way. It wasn't a professional talking down to a patient, but it was something about just saying it was offered in a much more different way because it was one layperson to another layperson and talking in their own language. I use the word women, but I think they also had men in this study. But these women were trained by specialists. So it wasn't like they were just saying whatever came to their minds. It was they were trained to offer this friendship bench intervention. The treatment was 6 sessions of problem solving and psychoeducation. So it was very much about trying to be very practical and focusing on what the difficulties were and trying to solve the problems together, as well as information about mental health, because sometimes it can be difficult to understand what's mental health, what's normal, what's not so normal. And as I said, it was called the Friendship Bench, which was deliberately friendly because there's so much stigma around. And it's important to actually try to normalize mental health problems. Tanya talked about how, if you say depression, people get quite scared. But if you talk about things like self-confidence, it feels much more normal. We talk stress, feels again more normal. It's important to be aware how some mental health terms can be quite stigmatizing. So depression, I think, is stigmatizing. Borderline personality disorder is another stigmatizing term. So there are these terms that can push people away rather than actually invite people in. And the other thing I wanted to say about the Friendship Bench was that it was a confidential service, and it was found to be very helpful and also very effective. And it's something that they're also trying out in parts of New York at the moment. So it was taken from Zimbabwe, and they're trying it out in New York. So my question to you is, what do you think of the idea? And please put it in chat, or we may have a chance to talk about it later on. One question I have is, what language should it be delivered in? Should it be delivered in English, or should it be delivered in an Indian language or a Pakistani language? So we're thinking about Hindi or Urdu. Where do you think it should be delivered? Might it be delivered at the Asian Resource Center? And how can we publicize it? So often it's difficult to publicize things. when you're trying to reach people who may not normally see the normal publicity. So it might be Asian radio, for example, or it might be that there's a newsletter that goes from the Asian Resource Centre. So those are my thoughts, and I would very much welcome your thoughts on what I've said. And as I say, please feel free to enter your thoughts on the chat, as well as talk when we come to the Q&A.
Thanks so much, Dr. Jin. And, you know, I really appreciate that you've raised some, you've really raised some of the issues that the Asian community faces, and that we are, you know, you said what we found as well in our studies, that we are less likely as Asian communities to seek help. You drilled down to some of those reasons as to why, and things like things been lost in translation, the shame, or what we call sharam, which is the fear and the secrecy around mental health. You spoke about, you know, things being misunderstood, the family being a point where they can be caring and also isolating, and also about the social pressures to reform. I mean, lots and lots of interesting, useful information, and really specific to the community that we work with. And I'd also add in something around, you know, marriage prospects within the Asian community can also be affected by if somebody's presented with having mental health problems. So there are so many issues, and I welcome the Friendship Bench in Croydon and look forward to working with you on this. So I'm really looking forward to the Q&A session now, and I'm going to hand over to my colleague Lizzie, who's going to take that over. I know we're pressed for time, Lizzie, so we will do our best to get as many questions as we can.
No problem at all. So yeah, what I'll do is I'll just jump straight in with some of the questions that were asked earlier on. So one that I think probably Dr. Vaishali or Dr. June could answer is it possible to have anxiety, stress and depression combined or simultaneously?
Hi, thank you, Lizzie. Just coming to that. Now, mental health doesn't have any defined sort of barriers, let's put it that. They're all interlinked. And as I was saying earlier, physical health and mental health are linked together. So anxiety, depression, low mood, it could coexist, and you could have all of it. But the question is, and it doesn't, you know, there's no age barriers there. You know, you could be sort of feeling a bit off, whether from the age of 15, and your 80-year-old grandmother also could be feeling exactly the same. It's about recognizing the features, understanding, having the insight of it. And I always tell, you know, my patients, the minute you've picked up your phone and made an appointment with me, 50% of your problem is sorted, because that is the hardest step to take, picking up the phone and agreeing to talk about your issues. So once we've sorted that bit out, we've dropped all the barriers, and things can only get better from them. So that's my sort of appeal to everyone. And yes, all these three conditions can coexist.
Yes, and I would agree with that. I mean, it just feels very much like we sometimes separate things out, but in reality, they can come together. Part of the reason that we separate things out is to also decide on what treatments to offer people who come. So what we have are particularly effective treatments for, say, depression psychologically, or particularly effective treatments for different types of anxiety, or particular types of schizophrenia, for example. So it's something about just saying, from a medical point of view, it's useful to separate out the different issues, but in reality, people often come with different kinds of problems coming together, which we would term as transdiagnostic problems. And sometimes you can treat those problems together. So like self-esteem, you can treat it together rather than have to go down the anxiety route and then the depression route.
Brilliant, thank you. I'm just going to pass over to Linda, who has a question, I think, for Susan.
Yes, that's right. Thank you, Lizzie. Susan, I used to attend an exercise class offered by Age Concern at Selsdon Library, which was excellent and it was well attended. But no one's contacted me since that first lockdown to say that there's any chance of joining an online class. So I just wondered how I would access that, please.
Okay, so first of all, Linda, I'm really sorry that you haven't been contacted, because we were contacting all of our clients to let them know what we're doing. Can I have your email address? And is it okay for me to pass it on to the Healthy Lifestyles manager to contact you directly? Yes. Because we can work with you one-to-one. People can email the Healthy Lifestyle Service or call our helpline, but if I could just take that forward with Becky myself.
Okay, thank you. I'll send it.
Lovely, thank you.
Thank you. Is Anita there? If you want to ask a question, if you're not there, then I can ask it for you. No. All right. So
Anita's question was, is it in various Indian languages, the Croydon talking therapies? That was a question in the chat group. Yes, Croydon talking therapies does offer various languages. On top of my head, I think it's there in Urdu, it's there in Punjabi. And it's there in Bengali as well. And language line is always there. We've always used right through the primary care and the various therapy services. So yes.
Brilliant. Thank you. So another question that came through on our chat was, do you think under the present situation of the pandemic that people can feel open to express their mental health concerns? So I guess that's sort of asking around more around the effect of this current situation.
I feel, people have sort of opened up a lot more. And we talk about mental health more. And the reason why, as with my experience in the Asian community, there's always that, oh, don't cry. I don't know how many Asians on this chat group have heard this, oh, don't cry like your sister. Be strong and get up and get going. That's always been a statement, as we've heard that from our parents, from our grandparents. That's always been there. So that get going attitude, and believing that if you bury your head under your sand, you're not going to see anything. That's sort of a feeling, that's an atmosphere. It's there prevalent in our homes. And it's where people talk about, why should we talk about your mental health? How will you get married? What's going to happen and who's going to marry you? So all these questions, create a confusion in our families, and that's the problem. And I'm really happy that things are starting to improve, and I can see that. People talk more openly about their mental health, but yes, we do have a long way to go forward. And today's session, I thought, was really with Dr. Brown and with Tanya doing her talk. And I thought this is just the tip of the iceberg. There's a lot more work to be done. And I hope all of us together can address this.
Brilliant, thank you. And if anyone does have a question, but they haven't put it in the chat, do remember you can put your hand up, or you can put the little icon up on Zoom as well. So I know that Kat, you've got a question, so go ahead.
Thank you. I've loved the comment of when you contact you, that's 50% of your problem gone. And what I wanted to ask on the back of that is, with the current pandemic and homeschooling and working and all the stresses, when does someone seek medical support? So the difference between feeling down and depressed, at what point should we advise someone to seek medical help?
I can sort of, the Tanya's bucket, she had that. And all our bucket sizes vary. And that's what we've got to draw a bucket for ourselves of how much we can take in. We all have different thresholds in life. And at a point where you see that it's going to impact your relationship, whether it's with your kids, your partner, your workplace environment, that's the time when you feel that your bucket is full and you need help.
I would say that it's when you start to actually suffer because of your problems. So for example, if you're depressed, then you go from just feeling a bit under the weather to feeling really quite lethargic and not having energy. And if with anxiety, it's also something about when it's stopping you leading your normal life in terms of, people avoiding situations or if it's really getting them down. So on we have all these assessments, and we talk about reaching thresholds before getting into services, but obviously that's not always available. But there is a kind of a threshold that is around, although IAPT doesn't always stick very closely to it because it isn't how it's designed, essentially. But it's something about when the mental health problems begin to affect people's lives.
Brilliant, thank you. I'm just going to pass over to Dudley, who has asked some questions in the chat, but I'll pass over to you, Dudley.
Thank you, and hello everyone. I do a lot of work with the BAME community, and especially on mental health and well-being, and really try to address issues of how to relate messages and people to come forward. But presently, there's been the government has released some new landmark reforms of mental health laws. I'm not sure if that's going to be helpful towards mental health within our communities at all.
So this is the review, isn't it, of the Mental Health Act?
It is indeed, yes.
Yeah. Yes, that only came out this morning, didn't it? So
yeah,
sure that,
so I mean, but some people may be aware of it. So that was probably my first question. If you can't answer that, fair enough. My next question is, because everyone has been basically on lockdown, and people are using technology a lot to sort of like help resolve matters, how effective would you feel technology is presently to cope and deal with, I guess, our community's matters of well-being and mental health?
Can I take your question sort of just from a help-seeking point of view, which is that with the Mental Health Act review, I think there is a point about Black people sometimes not feeling able to go early and go to the GP early, and then sometimes ending up in the judicial system rather than in the health system. And I guess from that point of view, it feels like a positive move. The second point is something about online. Online can be helpful from a psychological point of view. What I would say, though, is that sometimes the uptake and the dropout rate from online therapies might be higher than, say, face-to-face. So it can be quite good because it offers access to a lot more people, but it may not be that people will stay with the online treatment. So it's a bit like electricity. It has its pluses, it has its minuses. And the way that it's going, I think online communication is going to be a really key, is going to be part of what we offer in the future. Whereas previously it was much more focused on face-to-face with a bit of online for psychological therapies.
Thank you very much.
Thank you. So Jay, I see you've got your hand up. So JP, please go ahead.
No, I have a question for Dr. June Brown. The Friendship Bench project, I mean, it's an absolutely fantastic idea, and I would certainly like to get involved in it. The point that as a businessman that I have been encountering in the Asian community is, it is related to the social background, if you like, very passive. If you want to do it yourself type of culture. In a business world, you know, when an Asian person wants to open a business, he would probably save money to open the business rather than go to the bank and say, I need help. I have a vision and a fantastic idea. I just need money to start it. And that type of culture runs right the way through it. Just not just business. It is culturally, in marriage, in upbringing. Everything is down to do it yourself. So if you do need some expertise, if you can get some expertise with that cultural background in different contexts, that would be a fantastic model to build in terms of getting to keep it simple. I agree with you. I think some of the terms that are used are scary, are frightening. People might not understand the true meaning of that as well. but taking it and talking to them at level to level in a very simplistic term would be a great idea, because that's what probably is needed for more engagement.
Yes, thank you. Yes, because I mean, thank you very much for those two comments. So yes, the bit about language is from your what you've said is really helpful, because it's something that I've kind of gone around a bit on a soapbox to actually say, look, we need to keep the language simple, so that people can actually feel that it is within their control, and it's not such a scary bit. The first point that you made is quite an interesting one, which is about the passivity of people sometimes in South Asian communities. I mean, how I've sometimes seen it is that South Asians are much more of a kind of group-based community, whereas the Western community may be much more individualist. And there's pluses and minuses in the sense that the individualist society might be much more enterprising, but it may also mean that people may be less caring about other people in their community, and to just go for what they want. Over the weekend, I was having a bit of a rant about freedom, because so many people are going for freedom to do whatever you want. And I was just thinking, you know, I think we could actually just tone it down a bit, and just say, well, it might be freedom, but we're also responsible for other people. So it's something about recognizing and maybe appreciating a much more collectivist kind of culture that we might have amongst Asians, but also recognizing it that there may be some difficulties that come from that, rather than saying, yeah, I've got a difficulty, I need to do something about it. So thank you for that comment.
So we are still going to do our poll and just our sort of finishing off. So I'm going to let Anita have our final question. So go ahead, Anita.
Hello, sorry I wasn't here before. It's more of a comment than question. My question was answered with regards to languages, Indian languages, services provided in different Indian languages. From my working experience, what I have experienced is that from Indian communities, as Dr. Brown rightly said, they find there's some kind of a difficulty or hesitance in accessing service. People who have already accessed the service, fine, but to raise for psychoeducation and to raise awareness and to give that room for or encouragement to seek help, I think one-to-one or groups in Indian languages would be really helpful. I'm not sure if they are happening, because I'm not aware when I was working that they were happening in any form or shape. But I would love to know if they are, and I would like to also be helpful if we in future think of having such informal groups where we could have informal chats and encourage people to seek help.
Maybe that's something that we can bear in mind. I had a conversation with the IAPT manager a few months back, and one of the things that she did say was that they have tried to encourage more South Asian people to access IAPT, but were having difficulties. So maybe that might be a concrete way that things could go forward.
And I know I'm not an expert at all, but I just wanted to add that I know that, and I think Emma would back me up here, that Asian Resource Centre, we are constantly looking at sort of additional ways that we can support the Asian communities in Croydon, and to say that we will be doing further mental health talks and events, and some of those will be in smaller situations, because we're going to try and do language specific ones as well. So yeah, I know I'm not an expert, but I thought I'd jump in there saying it's coming up in the future.
No, that's good. That's good. I think we need the bridges, because sometimes it might feel like a long way between where somebody is and the help they might need. And these little bridges can be very important.
Thank you. Okay.
Oh, sorry, Emma. I was just going to pass over to Richard to do our poll.
Yes, I was just going to say one thing to Dr. Jean actually very quickly is in Croydon the languages that are the most commonly used Asian languages actually are Gujarati, Tamil, Turkish, and obviously the Hindi, Urdu. So I'd like if it's possible to have a conversation with you about some of the languages. We know that we don't ordinarily translate things into Hindi because a lot of the Hindi speaking community actually speak very good English too. So it's about really drilling down to the communities that don't access or have the language barriers. Perhaps we can have a conversation about that.
No, thank you very much for that. It's Gujarati and
Gujarati. Tamil is the most spoken language in Croydon, and there's around a good big community of Turkish people as well in Croydon too. So we are doing some work with public health around communications and language specific things and doing linguistic insights. So we're working with King's College at the moment of things like oral languages like Sylheti and Farsi, where they don't have a written form, so you have to be done in video and that sort of thing. So as
thank you very much.
As you said, we are actually at the end of the session, and I would plea everyone, if you can stay for a few more minutes. We've got some really interesting things coming up now just to conclude the meeting. So as Lizzie said, thank you, Lizzie, very much for facilitating yet another brilliant Q&A session. And I'd like to hand over to Richard now, please, if you could do the second poll so we can compare the results.
Thank you, Emma. Good afternoon. I'm going to ask you the same question that I asked earlier. So it's a repeat of the poll. And just to remind you what the question was, and before I do ask you, also to remind you, it's completely anonymous. Nobody will be revealed as to what your response was. If you or someone you know had a mental health crisis, do you know where to contact in Croydon? And the answer options are yes, no, or not sure. It should be up on the screen now. So at the moment, we've got 66% of today's audience in the room have voted. Once the figures stop changing, I'll update you. It's looking really positive so far. So earlier on, I'll remind you of the figures from earlier. We had 15 people say yes, which was 45%. 12 people say no, which was 36%. And 6 people say not sure, which was 18%. Right now, we have 76% of today's audience in the room have voted. We have 30 people have said yes, which is 83%. 1 person has said no, which is 3%. And 5 people have said they're not sure, which is 14%, which is a massive improvement on this morning's figures. So from 45% yes to 83% yes, I think that's really positive. Thank you everyone for taking part, and I will now hand back over to Lizzie or Emma. Who's it going to be?
Oh, well, we're actually going to Kat.
To Kat, sorry, to Kat then.
It's good, everyone's meeting the whole time. Go ahead, Kat.
Thank you. If you haven't been before, just so you know, we do a raffle for a small coffee hamper that gets delivered. Please, if I pull out your name, can you privately message me your address? I can't give it to you if I don't know where you are. So I'll go first. I've got a very sophisticated handmade bowl here. Oh, and it's Jamila.
Oh, well done.
So we do 3 of these. Third one is Ming.
Oh, well done.
I'm hoping there's one of each of these names, not several. And last but not least, we have Florinzo. But I will drop you.
Well done. Excellent.
So if you can privately message me your address, and we will make sure that they are sent to you in due course. Thank you. Congratulations.
Cool, thanks, Kat. And then passing over to Deborah for our last thing, really.
Hi everyone. After a long time, meeting with me. Who got birthday this month? Can I see some hand or message?
Can you repeat, Deborah?
Who got birthdays this month in January? Who got birthday?
I see.
We used to do. Long time we didn't do because we didn't see anyone.
Oh.
Any
Anybody?
birthday?
A birthday in
We
December.
have Lisa.
Lisa.
We have Lisa. We have Elsie.
Elsie.
Oh. Oh, okay. Can we sing a song for everyone, please?
Happy birthday.
Yes, yes, yes. Let's start.
You can all unmute yourselves.
Everyone unmute themselves.
Unmute and sing a song for the birthday girls.
Okay, let's go.
Great, let's start.
Happy
birthday
birthday
to you.
Happy
birthday
to you.
Happy
birthday
to
Happy birthday.
Happy birthday to you.
Hooray! Hip, hip, hooray! Great. Thank you everyone for coming and joining Coffee Morning.
Bye. Thank you so much. It was very good. Thank you very much.
Thank you, ladies.
Bye-bye. Bye.
Really good session.
Bye.
Thank you. Bye.
Date of the next coffee morning.
Just to let you know that we've got our next session on the 17th of February 2021. Can you believe we're there already? And it's almost February, from 11 a.m. to 12:30 p.m. And the theme will be healthy nutrition and diets. We will be looking at South Asian diets as well, and see how we can all get healthy during the pandemic. So I look forward to seeing all of you. Tell your friends and family about it so that they can benefit from the session. And one day we will get the synchronized thinking right. It sounds good. So thank you very much. And thank you to my speakers.
Thank you. Thank you.
Can we get some synchronized clapping
Namaste.
going? Synchronized clapping going.
Clapping going.
Thank you.
Thank you.
Sure.